Welcome back to the YouTube channel. I'm your host, Myammee. And today we're filming at the Children's Diagnostic and Treatment Center located in Fort Lauderdale, which provides medical, dental, and so much more to those in Broward County with special health care needs, including programs like the HIV and AIDS Family Comprehensive Program for those diagnosed and affected by HIV. So stop by and call them today. Now, living with HIV, there are some new commitments that you must make. But at the same time, choosing the right doctor and choosing your doctor, they also must commit to you as well. So today we're going to discuss everything about the patient and doctor relationship. Now, when it comes to the patient and doctor relationship, the show is all about you. The reason why this is so important for you is because you don't need any extra stress. And not having the right doctor can add extra stress to you that you really don't need. So because your doctor should be looked at like a partnership, you should be able to be open and honest with them about everything. And plus, you should never be afraid to speak up for yourself. Remember, this is your life. This is your body, your health, and your future. So if you don't have a doctor that you can communicate with effectively, how are you going to live your best life? So keep that in mind, you guys. And if you have any questions or any concerns, make sure you contact the Broward County Ryan White program so they can help you and switch you out with a new doctor who's more alert, who's on your side, and who can hear and understand you so well. So to give you some more insight between the doctor and patient relationship, we're going to speak with Dr. Rojas, and she's going to go over a few details about how important it is to have an open and honest relationship with your doctor and any other extra information that you just may need.
So my name is Dr. Vanessa Rojas. I am both a family medicine physician and an HIV specialist. I do both primary care and HIV care for patients living with HIV. The patient relationship is extremely important, especially when trying to feel safe. Oftentimes, patients feel nervous or anxious about disclosing facts about their sex life or about their social situation to myself as a physician. But oftentimes that just leads to confusion and questions left unanswered. So when those aspects of their lives are disclosed and discussed, we're able to have a much more honest and open relationship and come up with a plan to really treat their HIV as best as possible. I would say honesty is one of, if not one of the most important aspects of providing care, especially in the HIV world. I oftentimes get lab results back where I'm confused as to why the viral load is out of control. For example, had a patient and she admitted that she just fell into a very deep depression and that's why she wasn't taking her meds. And I said, okay, well, let's get you some help for the depression. And by the next visit, she was undetectable again. I do a lot of referrals to our mental health counselors here physically in the clinic. And I also are able to refer them to psychiatrists and mental health counselors at other outside agencies in the area. I really think that forming that doctor-patient relationship is truly important. So if you don't feel comfortable with your physician or your provider, you probably should look into switching to a different one. Is that difficult? Yes. Many patients tell me that it's difficult because they have to talk about their diagnosis all over again. But building a strong doctor-patient relationship is what ultimately will help keep you undetectable for long periods of time. Because if you have that trust and that bond between yourself and your provider where you just feel comfortable talking about anything and everything and ultimately just getting better care. Okay, that's a very good question. I do not practice cookie cutter medicine. Why? Because I feel that it's important that as a physician you treat each patient individually. So every patient that walks in the door that's newly diagnosed, I have a long conversation with them and ask a lot of questions about their medical history in order to determine the best medication for their care. Within one visit, I can determine what's the best medication for that patient. Obviously, I have to ask a lot of questions related to their medical history and where they're at in life is actually very important. And then I determine what the best medication is for them. Wouldn't say there are any major symptoms that alert patients between visits, but what I always tell patients is that if you have a question, just call the office, because sometimes patients don't call and it turns out to be something major, and patients sometimes call and it turns out to be nothing. But how are you supposed to know? And you have to feel comfortable with your physician's office and calling and asking questions, because the medications do have side effects. They are medications. Every medication has side effects. Why shouldn't you be able to ask about your HIV medicine and what side effects it's causing, and if it's something I have to worry about or not? So something that I always tell my patients, especially those who are struggling with stigma, is that you are much more than this disease. You are a mother, you are a daughter, you are a son, you are a cousin, a teacher, whoever you are more than a disease. And the reason I tell patients that is because you do not have to be defined by having HIV. I have patients who are well into their 80s and they're complaining about arthritis pain and their grandchildren being a pain in the butt. They're not worried about their HIV. So it's not something that has to take over and control your life. Take control of your life by taking your medicine every day, and let HIV be something in the background so that you can go out and enjoy time with your family and your friends and live a normal, healthy, happy life.
So remember, don't be scared, don't be nervous, be your own advocate. Create a journal in your phone or in a notepad. Jot down anything you may want to ask your doctor in your next doctor's appointment, or even you may want to call over the phone in between your visits. So overall, you guys, I hope you learned something so important today on how the Broward County's Ryan White program and their doctors can help you live a longer and healthier life, because they are educated. They are well equipped to handle all of your needs outside of just HIV and any other complications that you may face in the future, including any other mental or other services that you may need. So you guys, make sure you go ahead and call them up right here. Here's their number. Make sure you call them. Make sure you email them if you have any other questions, or just comment below what you guys think. And lastly, the most important thing of this whole thing, make sure you guys subscribe to this channel. Make sure you hit that notification bell, because that bell will alert you every time we upload a new video. Any other tips, any other educational material, you're going to find out right away. And don't forget to follow them all over social media on Facebook and also on Twitter. So that's it, you guys. I'm your host, Myammee, and remember, you got this, you can do this, and I'll see you guys on the next video.